20% of heart attacks strike individuals with optimal cholesterol levels and consistent exercise habits. They appear perfectly healthy until they are clutching their chest. To see how your own circulation is performing, try a quick physical assessment. Press your thumb firmly against your index fingernail until the nail bed turns completely white. Hold it for 5 seconds, and then release. You are physically forcing blood out of the tiny capillaries under the nail. Once released, pink color should return in under 2 seconds. If longer, peripheral circulation is compromised. Narrowed arteries mean only a struggling trickle of blood reaches the nail bed. This is a crude screening tool with specific limitations. A slow refill can be caused by simple dehydration, exposure to cold temperatures, or even anemia, a condition where the body lacks enough healthy red blood cells. However, the test highlights a vital rule. Symptoms at the extremities are often late-stage signals. Preventing a cardiac event requires looking into the cardiovascular system decades before outward signs emerge. Within your coronary arteries, blockages exist in 2 forms. While calcified plaque is hardened and stable, soft plaque is a lipid-rich, inflamed deposit that can suddenly rupture and trigger a fatal blood clot. A standard coronary calcium score only detects hardened plaque. Many patients receive a score of 0, while their arteries are actually filled with dangerous, uncalcified soft plaque. For those at higher risk, doctors use computed tomography angiography, or CTA. This imaging technique uses contrast dye to reveal the entire path of the artery, including the hidden soft plaque that standard scans miss. The contrast dye brightly illuminates the arterial interior. This allows specialists to identify vulnerable, thin-capped plaques and determine if the vessel is dangerously narrow before a rupture occurs. Imaging can only map the damage that has already occurred. To stop the growth of soft plaque, you must identify the metabolic triggers that cause it to form. The primary hidden driver is insulin resistance, which can be identified by a fasting insulin level above 10 microunits per milliliter. Fasting insulin measures the amount of insulin in your blood after a period of not eating, identifying metabolic issues long before blood sugar rises. When excess insulin remains in the blood alongside uncleared glucose, it creates an inflammatory environment. This process generates oxidative stress that physically scars the inner lining of the arterial walls. This injury triggers systemic inflammation, which is measured by high-sensitivity C-reactive protein, or hsCRP. This test quantifies the total level of inflammation and irritation occurring throughout your cardiovascular system. Environmental factors play a major role in this inflammatory response. Breathing heavy smog with an air quality index above 300 introduces microscopic particulates into the blood, raising heart attack risk by 20%. Inflammation also stems from internal infections, like periodontal disease. This condition allows oral bacteria to enter the bloodstream, where they provoke a constant immune response that damages the arteries. Whether the trigger is metabolic or environmental, chronic inflammation acts as a persistent accelerant for arterial blockages, operating entirely independent of your cholesterol levels. A third hidden force is lipoprotein A, or LPA. This is a genetically inherited, highly atherogenic particle that promotes plaque formation and blood clots in roughly 20% of the population. LPA creates a 3-pronged threat. It drives plaque accumulation, fuels systemic inflammation, and prevents the body from breaking down the clots that cause heart attacks. Standard statin drugs are ineffective here. They bind to regular cholesterol, but bounce off the unique structure of LPA. Furthermore, a standard annual lipid panel does not even check for this particle. Because LPA levels are determined by your DNA and do not respond to diet or exercise, those with high levels must aggressively manage every other risk factor to survive. By the time you experience chest pain or fatigue during exertion, your arteries are typically 70 to 90% blocked. This is the final stage of the disease that actually began decades earlier. The plaque was quietly accumulating while you appeared healthy and passed basic medical screenings. To catch this process early, request a blood panel for fasting insulin, hsCRP, and LPA. These 3 tests generally cost less than $100 total and identify the risks that standard checkups miss. If you have a family history of heart disease, secure a coronary calcium score. If those results or your blood markers are elevated, move to a CTA scan to evaluate your soft plaque burden. Proactive cardiovascular care identifies invisible blockages using advanced diagnostics before the system reaches the point of failure.